Dr. Philip Huang, Director of Dallas County Health and Human Services, thank you so much and welcome to Eye on Politics.
Thank you.
So today you are giving a tour to Congressman Mark Vesey, Dallas County Judge Clay Jenkins, to your facilities here in Garland. And what is your message to them, both particularly Congressman Vesey as it relates to public health funding?
Sure. Well, we're so glad that they could see the services in action and just the importance of the federal funding for so many of our programs. I think we've estimated 93% of our budget is actual federal funding. So, we went to our refugee screening program, some of the immunization services that we have here, and really glad to be able to show these federal dollars at work. I mean, sometimes people think, okay, money going to CDC just stays at CDC, but I think 80% of it comes down to the local and state level.
And so there's been a lot of discussion, obviously, since the Trump administration about cuts to funding for public health. And so how has the county been impacted by that? Have you seen cuts yet?
Yeah, I mean, we have already seen, we lost about $4 million with the cuts to the COVID funds, and they were COVID, but they were used beyond COVID. So some of that was for vaccinations, and we were doing certainly COVID vaccine, but also flu shots, childhood vaccines. I mean, we had to lay off 25 staff. We had to cancel over 50 of our community vaccination clinics that were out in the community, these outreach pop-up events over the next year. And that was in the middle of the measles outbreak in Texas, where we had even approached some of the schools that had low vaccination rates and worked with them to try to do some events at their schools. And we were having to cancel these things, again, for childhood vaccinations in the middle of a measles outbreak.
So let's talk about as far as the COVID funding. So it was $4 million. You said you had to lay off 25 staffers and cancel some of these events. So what does that mean then for public health?
So, again, these are services, vaccinations we can't give. We also had 4 of those staff were epidemiologists. So these are the investigators that follow up on any reportable condition, whether foodborne outbreak or measles, when we're doing investigations of suspect measles cases, interviewing them, finding out what their risks were, any exposures for so many things. And then also we had to lay off 2 lab staff. And some of the funds for some of our lab equipment that, again, go beyond just testing for COVID, but we were looking at building our capacity to do more measles testing locally. So all of these things are impacted.
And as far as the $4 million that the county lost, so is the county still having to pick up those costs, and have you been able to still provide some of these services?
So again, those costs are gone. Now, there were 23 states that actually sued and have continued to be able to receive those funds. We were not one of those states, and so we have not, again, we had to lay off the staff. We've been trying to do, in terms of the pop-up community outreach vaccination clinics, we've been closing one of our brick and mortar clinics 1 day a week to try to use those staff then to do some more community outreach. But again, we had to cancel over 50 scheduled clinics.
And what about the impact here at this facility that you were showing the Congressman and Judge Jenkins?
So one of the refugee screening program, that was a separate funding sort of delay that we had. The funds were frozen after January 19th. It was uncertain whether we would be reimbursed for the services that we were providing after that date. Finally, in April, the funding stream was reopened. I think it was after Catholic Charities in Fort Worth sued to get those funding available. And so those are services, and people sometimes don't understand exactly what that program serves. It's serving these, refugees, the people that are coming from their country fleeing because of safety reasons, threats, and then also some of the special immigrant visas, immigration visas, that these are the people like the translators that helped our military in Afghanistan and others that are staying in their home country. They're threatened, great risk to their own personal safety, and we're sort of promised the opportunity to be able to come through this program. And so that's what's been disrupted. We don't know what the funding's going to continue with that. Some of these people have been in the refugee camps for 5 to 10 years because they go through rigorous screening to verify and validate the safety concerns and their threats to their own personal safety.
And so long term, do you know what cuts are coming down the pike? Because obviously in the bill that was passed by Congress, there are cuts to the growth in Medicaid. So that's going to have an impact, obviously. Have you been notified about exactly where you're going to expect those cuts?
So those are some of the cuts that are known, and those will, impact other services like Parkland, the hospitals, and others. We're still uncertain about what our funding in the next budget year is going to be. I know we've seen the president's proposed budget and some of the other budget proposals, but it's still uncertain. And then, what was also uncertain is some of the funds that we were talking about were actually already appropriated from last fiscal year, but they were delayed in getting to us. So, Congress had approved these funds, appropriated them, and then we weren't getting them. So even just this uncertainty causes tremendous, chaos for us on the front lines. I know several places have, laid off staff because of these delays in funding. I know Tarrant County has canceled their whole refugee screening program, so now we're getting the patients from that program. And again, some of the delays to other programs, I've heard other health departments, because they can't maintain the staff when there's uncertainty if they can pay for the staff salaries, they have to lay these people off, and you can't put it back together. And that doesn't even talk about, the cuts at the federal level, because there have been huge, cuts in CDC staffing. And these are the programs. I mean, I was just talking to some CDC staff about to really understand the impact of the loss, total destruction of programs at CDC that we rely on at the local and state level for their expertise. These are some of the national experts on various infectious diseases and things that, again, at the local level, that's the people that we rely on for support, for guidance, guidelines. And some of these national and world experts have been laid off, and you're not going to be able to get that and build that back up.
I was just going to ask you, so who do you call in the case where you have a problem with, an outbreak, et cetera?
Well, again, there's, there were early on communication restrictions, so we couldn't even talk to people at CDC and get that guidance. So we just have to wing it with, whatever resource. But for instance, with measles, it was because we've had a safe and effective vaccine for so long, it was declared eliminated in the United States in 2000. So most physicians, most healthcare providers here have never seen a case of measles. I've never seen a case of measles. And when there's something like going on in West Texas and an outbreak, you want to have the expertise of the people who have actually dealt with it. And so CDC sends out people to, when there are outbreaks in the United States or even globally, so to know and have that experience and how to deal with it. And now, a lot of these staff are laid off, or we don't have access to that. And so we're sort of out in the cold. And I think you're hearing more about what happened with some of the things in West Texas and that lack of access to that.
Well, I know there were CDC staff that were sent to West Texas and all that. I know the measles outbreak wasn't very serious here, although I know you had some cases, right?
We had one confirmed case. But there still it affected our operations because there were a lot of suspected cases, a lot of people being reported saying, "Oh, we think we've got a measles case." That we have to then still interview the patients, investigate, see if they're actually measles or not. So it impacts all of us in public health. Fortunately, we did not have certainly a situation like was seen in West Texas.
Last question, and that is, what is your message now? You spoke with Congressman VC today, so what was your message to him?
I think really to how important these federal dollars are to us at the local level. And we depend on these funds for us to be able to be, address outbreaks, to be prepared for future outbreaks. Something like COVID, that's another threat. Some of the preparedness dollars, public health emergency preparedness dollars, we've seen a 28% cut in that funding right now. And that's what helps us be prepared for whatever we may see, whether it's another COVID, Zika, Ebola, H1N1. All of these things are things that we have to deal with and have had to deal with. And it's these dollars that help us be prepared so that we're not starting over again when we get something like that.
Dr. Philip Huang, thank you so much. We appreciate it.
Thank you.